My name's Kelly Might. I'm a veterinary surgeon in Austin, Texas, and I own Austin Area Mobile Veterinary Surgery. So before lick sleeve, I pretty much exclusively used e-collars, just like I think all surgeons and veterinarians do. It was always a pretty frustrating experience in the sense that dogs hate them, owners hate them, they're tough to put on, dogs will wrestle them off, they get dirty, they get knocked on doors. They're just kind of an inconvenient necessity to use. Pretty much used them on all orthopedics. We do about 90% orthopedics, so we were having to use them on the vast majority of our cases. Before every surgery, I always have a phone call with the owners, and I'll go through the aftercare procedure, and owners would always invariably ask, do they have to wear a cone? I mean, it's unfortunately just something that we would tell them it's only for 2 weeks, but really it's an important part of the recovery because we've got to make sure that it doesn't get infected, and the e-collar was really the only solution or only option we had. And then last year, we would just offer it to clients as an option along with the e-collar, and just got really good feedback from owners. It seemed like it was a lot easier for them to use. They liked the fact that it could be washed. Just seemed like it was a lot easier for them to use at home and probably higher compliance. I think that's one of the really hard things, is being able to determine objectively what our compliance is with an e-collar or a lick sleeve. And I think clients just feel like this is so easy to use that I have to think that the compliance rate is higher. We got enough good feedback after using it for a few months that I just started incorporating it into our estimates for all surgeries, and it's basically just included in all orthopedic surgeries that we do. So it goes home with every dog. As long as there's an appropriate size lick sleeve, we send it home automatically for all dogs. After TPLOs, lateral sutures, patella luxations, mass removals on legs, we send it home with all of them. I think it's a very easy conversation with owners to talk about the lick sleeve because they all dread using the e-collar. And even though we can't, or I don't recommend totally eliminating the use of the e-collar, they are very grateful that there is another option to use. So they're often very happy to hear about that. I would absolutely recommend surgeons trying out the lick sleeve and see how their experience is with it, because I think they'll find that owner compliance is probably higher and owner satisfaction with the recovery is higher.